back. So, panibagong ano naman siya, illness. Yung babasahin natin. Ito naman to siya yung hysterectomy. Hysterectomy is the complete removal of the uterus. So, process siya ng pagtanggal pala. Mm. Until comparatively recently, it was an almost routine operation, seen as a cure for all manner of female complaints. Although it is the second most common operation performed on women, it is now performed much less often as women have questioned its necessity. Newer technologies are also providing alternatives. The most pressing reason for a hysterectomy is cancer in the uterus or cervix. Kaya palang hirap talaga pag magka-cancer ng uterus or sa cervix. I-remove yung uterus. So kung i-remove yung uterus, wala lang, hindi na pwedeng magkaanak. It may also be recommended for other severe conditions that have not responded to previous treatments. These conditions may include heavy bleeding and pain due to fibroids. A hysterectomy should not be necessary for even quite large fibroids that do not cause severe pain or bleeding. After the menopause, they are likely to shrink and disappear of their own accord. A uterus that is rapidly swelling from bulky fibroids or a growing myometrium. Myometrium. Benign tumors, especially when growing into the cavity of the uterus. Abnormal bleeding and pressure in the pelvis, perhaps causing permanent incontinence and bladder problems. Severe menstrual pains leading to fainting and illness every month. Prolapse of uterus. Abscess, pelvic inflammatory disease, severe 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 core chorea. Leucorrh. Chorea. White or yellow smelly discharge from uterus when antibiotics or anti-inflammatories have not worked. It is necessary. There are plenty of reasons to question whether a hysterectomy is necessary. This is radical operation and there is risk attached to any such procedure. The uterus is only a small organ, but it has a tremendous effect on your body. An oophorectomy, oophorectomy, oophorectomy involves the removal of the ovaries as well as the uterus. The procedure must be discussed beforehand, as removal of both has the effect of inducing an instant menopause due to the loss of hormones produced by the ovaries, which, if very premature, may have long term consequences for your general health. For a younger woman, there can be deep seated psychological effects of having the uterus removed. You will not technically be in any less complete a woman, but many feel exactly this, in the irredeemable loss of the ability to bear children may be difficult to come to terms with. Some hospitals and some surgeons will turn to hysterectomy as the answer more readily than others. Do not hurriedly agree to a hysterectomy because of pain. Ensure that other conditions such as intestinal adhesion, gallstones, kidney stones, and even appendicitis, all of which can cause severe pain in the abdomen, have been ruled out. If there is a pelvic mass that cannot be evaluated, an ultrasound scan in an MRI scan should help diagnosis before surgery is considered. That said, a hysterectomy can sometimes be the only answer and may be life saving. Discuss with your doctor or gynecologist the possibility of a vaginal rather than abdominal operation. Using the vagina to gain access to the uterus rather than cutting into the pelvic area lessen the trauma to the body generally and reduce the chance of infection. In cases of cancer, however, it will probably be necessary to remove the ovaries too, and it will be important to examine lymph nodes in the pelvic region for any signs of the cancer having spread. This will probably require abdominal surgery. Before surgery, any operation is debilitating, and you will recover more quickly and more completely if you can prepare your body as well as possible beforehand. Surgery on any part of the abdomen will leave the whole area feeling sore. Any pain will exacerbated by additional pressure from abdominal gas or blocked bowels. Make sure you do not have high stomach acid. Heartburn and indigestion will seem all the more acute after abdominal surgery. Gastritis also impairs iron absorption. Eat slowly and avoid citrus fruits, deep fried foods, alcohol, except an occasional glass of wine of drashazaba, an Ayurvedic balsam of fermented grapes and herbs. Painkillers, unless there is severe menstrual pain, high doses of vitamin C, more than 500 grams at a time, nuts, chilies, heavy curries, pineapple, and mango. Make sure you are not constipated. If one of your symptoms have been heavy bleeding, you may be anemic to some degree. Eat plenty of foods rich in iron and in elements that aid iron absorption. Liver, red meat, game, pulses, dark green leafy vegetables, dried ginger. Take iron supplements. Prepare yourself for after the operation. You will not be able to very active for a few weeks afterwards, and this and the hormonal changes mean you are likely to put on weight. Without depriving yourself of any nutrition, lose what excess weight you can now. See the chapter on weight control. See also, I have said at the very beginning of this chapter, reproductive health is not independent of the rest of the body. Other sections of this book that may be relevant or helpful include ectopic pregnancy, miscarriage, contraception, menopause, and control. So, ano hindi natin to? Ibang-ibang pages kasi siya. Ectopic pregnancy is page 147. Nandito pa lang tayo sa 113. Contraception is 132. Miscarriage is 171. Menopause is 302. Weight control is page 219. Datating tayo dito. So, prepare yourself for after the operation is yoga and relaxation techniques will help to still your mind and improve your well-being. You may react to losing your uterus more strongly than you think. After surgery, follow the recuperation guidance in the chapter on general disorder and problems. Pay particular attention to what you eat and drink because your whole abdominal area will be tender and vulnerable. So your digestive system should not be put under any strain. To help ward off weight gain, keep carbohydrate, alcohol, and fat intake under control once you are eating proper meals again. Take hormone support supplements for 3 to 6 months to regulate the hormones. Ang hirap kung magkakaano ng itong ganitong klase na removal, hysterectomy. Daming changes sa body. So, be careful talaga tayo. Kaya pala talaga kailangan talaga ng extra careful sa mga food na ini-intake natin. And more water. Maging habit yung 1.5 liters a day. Okay. So, pero talagang just relax. Mawala dapat si stress para hindi siya dun sa body. Okay. Ingat sa lahat. Bye-bye. Meron naman tayong natutunan ngayon. Bukas na ulit kasi 7:29 na dito. Need to prepare pa sa mga ibang bagay. God bless everyone. Bye-bye!